Assalamu alaikum, everyone. Imagine a disease that can start with simple fever and headache, but within hours can become life-threatening. Recently, several cases of meningitis have been reported in the UK, with students hospitalized and even deaths reported in Kent. But the important question is, what exactly is meningitis? Why are cases rising again in the UK? And how can you protect yourself and your children? Today in this video, I will explain everything about meningitis, its causes, symptoms, treatment, and the reason behind the current outbreak in the UK. I am Dr. Naeem, and let's start.
Types of meningitis. There are several types of meningitis. 1. Bacterial meningitis. This is the most dangerous type. Common bacteria include Neisseria meningitidis, Streptococcus pneumoniae, and Haemophilus influenzae. Bacterial meningitis has a high mortality rate and requires emergency treatment. So, let's know about viral meningitis. This is more common, but usually less severe. It is caused by viruses such as enteroviruses, herpes virus, mumps virus. Most patients recover with supportive treatment. Fungal or parasitic meningitis. These are rare and mostly occur in immunocompromised patients. Symptoms of meningitis. The symptoms can start like a simple flu, but they quickly become severe. Common symptoms include high fever, severe headache, neck stiffness, nausea and vomiting, sensitivity to light, confusion, difficulty waking up. In advanced stages, patients may develop seizures, cold hands and feet, skin rash that does not fade when pressed, rapid breathing. These symptoms require immediate medical attention. How meningitis spreads. Many people think meningitis spreads very easily, like COVID or flu. But actually, meningitis spreads through close contact. Transmission occurs through coughing, sneezing, kissing, sharing utensils or drinks. The bacteria often live in the nose and throat of healthy carriers without causing disease. But in some individuals, it suddenly becomes invasive. Why is there a meningitis outbreak in the UK? Now let's talk about the current outbreak in the UK. Recently, a cluster of cases appeared in Canterbury in Kent, mostly among university students. More than 20 cases were reported, and unfortunately, 2 deaths occurred. Health officials believe the outbreak started at a nightclub where many students gathered, leading to close contact and rapid spread. Main causes of the UK outbreak. Several factors may explain the rise in meningitis cases. 1. Decline in vaccination rates. After the COVID pandemic, vaccination uptake dropped in many groups. This has left some teenagers and young adults less protected against meningococcal bacteria. Close contact in universities. Students living in dormitories, hostels, shared accommodation have a higher risk. Close social interaction allows bacteria to spread easily. 3. The Men-B strain. Most recent cases in the UK are caused by meningococcal group B, Men-B. In fact, around 82% of meningococcal cases in the UK are due to Men-B. 4. Seasonal factors. Meningitis is more common in winter and early spring because respiratory infections increase during these seasons. Who is most at risk? Certain groups are more vulnerable to meningitis. These include infants and young children, teenagers, university students, people with weak immune systems, people living in crowded environments. Diagnosis. Doctors diagnose meningitis using several tests. These include blood tests, lumbar puncture, spinal tap, CT scan or MRI, and PCR tests to detect bacteria. Early diagnosis is crucial to prevent complications. 10. Treatment. Treatment depends on the cause. Bacterial meningitis. This is a medical emergency. Patients require immediate IV antibiotics, steroids, oxygen therapy, and intensive care monitoring. Viral meningitis. Treatment usually includes rest, fluids, and pain relief. Most patients recover within 1 to 2 weeks. Possible complications. Even after recovery, meningitis can cause serious complications. These include hearing loss, brain damage, seizure disorders, learning disabilities, limb amputations in severe septicemia. Around 10 to 20% of survivors develop long-term complications. Prevention. The most important prevention is vaccination. In the UK, routine vaccines include Men-B vaccine for babies and Men-ACWY vaccine for teenagers. Other preventive measures include avoid sharing drinks or utensils, cover mouth when coughing, and maintain good hygiene. People who had close contact with a patient may also receive preventive antibiotics. Meningitis may start like a simple infection, but it can become life-threatening within hours. Recognizing symptoms early and seeking medical care immediately can save lives. Vaccination remains the most effective protection against this dangerous disease.
If you found this video helpful, please like, share, and subscribe to Dr. Naeem's channel for more meditation videos.